COVID-19 hospitalizations are skyrocketing in some areas of the country. Missouri is one of the states feeling the pressure from the Omicron surge. It has one of the lowest vaccination rates in the U.S. Carter Evans reports.
Good morning, Pam. I'm going to open your eyes.
At St. Luke's Hospital, Dr. Andrew Schlachter and his colleagues are treating COVID patients everywhere they can.
You're in our neurosciences ICU.
If you have someone who comes in with a neurological issue right now and you don't have any beds, where do they go?
Right now, we try and take care of patients in any variety of places that we can.
Just since December, the number of infected patients here nearly tripled. Out of 286 COVID patients at this hospital, only 15 are vaccinated.
Are you coughing?
A little.
Pamela Maples avoided the vaccine because she thought it was more dangerous than COVID.
Were you concerned about COVID before?
When she tested positive last month, she was in the hospital 8 days later.
I had no clue it would be like this.
What did you think it might be?
Oh, like it's a flu. It's a regular old flu. And that's what everybody kept telling me.
It's a story nurse Kristen Sollers hears too often.
There's a lot of anger about the community not wanting to take care of themselves and asking for us to pick up that slack when they become critically ill. And other days it's really profound sadness because we have the saddest stories you've ever heard in your life.
And after weeks in the hospital, Pamela Maples is now begging others to get the shot.
Take the vaccine. It's very, very important.
Now, Pam Maples' ex-husband was also in the hospital here with COVID. He died last week. And even after all she's been through, all her family's seen, she says she still has some close friends and family members who won't get vaccinated. Vlad and Anne-Marie.
Oh, that is so frustrating. Carter, thank you very much. So Dr. Jen Caudle is here to help answer some of the questions about COVID. She is a family physician and is an associate professor at Rowan University. Thanks for joining us. I want to kind of pick up where Carter Evans ended. You know, in the hospital where he was, they're reporting the vast majority of the people who are there with COVID are unvaccinated. I can't imagine the range of emotions that medical personnel must be feeling when they are treating people who are unvaccinated and end up with COVID. I mean, there's a tremendous amount of compassion, but there's also an awareness that the vaccine is available, it's free, and that woman did not necessarily have to wind up in the hospital. Can you talk a little bit about just the emotional roller coaster that medical professionals are going through 2 years into this pandemic?
Sure. It's frustrating. It's frustrating to see people getting very, very sick when we don't feel they have to. Based on the best science that we have, we know that people who are vaccinated do much better than those who are unvaccinated. We know that the risk of hospitalization and death is much higher when you're unvaccinated. And we know our hospitals are filled with many unvaccinated people. It is frustrating. But beyond that, look, we took an oath to do no harm, and we are physicians and healthcare providers because we want to help people. It's sad to us, and it's sad for us. It's not just frustrating. There's an emotional sort of sadness that goes along with seeing people who are not doing well. It takes a toll, not only on those folks, but on the people who are taking care of them as well. It's honestly quite devastating. And the last thing I'll just add to that is it's also confusing. We're still, I know I am in the office, confused when patients of mine still refuse the vaccine, even after they've had COVID and gotten really sick with it. So all of those things and more is what we're feeling.
Yeah, doctor, it's striking, too, because I think that the danger is that as more and more Americans are vaccinated, let's face it, I mean, everybody that I know personally has been vaccinated and has even been boosted. And I think that there's a risk that because you're in your bubble and you imagine, well, everybody's, pretty much vaccinated. And so I can go about with my life. And why can't I go about with my life? Why can't I stop wearing a mask? Or why can't I just do the things that I did pre-pandemic? And we sometimes forget that there are people who are unvaccinated, who are immunocompromised, who are at risk, and they are still suffering. Their families are still suffering, and you in the medical profession are having to deal with that. And I just worry that fuels the narrative that this is behind us.
I think that's a really excellent point. I like the fact that you mentioned this concept of a bubble, because I do think that especially if we are in pockets of groups where we are all vaccinated, right, which thank goodness you and your family and friends are, it can be hard to remember that a lot of Americans actually are not. And the reason why none of us can go without our masks or sort of live life as usual is because there are so many people unvaccinated and the cases of COVID are so high. One of the reasons cases are so high is because we have so many people unvaccinated. So, the point being here is that we are not out of the woods, and there are still too many people who have not gotten the vaccine. There's also still too many myths and too much hesitancy running around about the vaccine, which is causing a lot of people to not get that.
I know, doctor, when I was listening to that patient say, she thought it was just going to be like the flu, I was also thinking, well, the flu is not a walk in the park. If anyone's actually gotten the flu, not a cold that they think is the flu, but the real flu is not a walk in the park, particularly if you're older. We know that the flu is responsible, kills thousands of people every year. So why would you even want to risk it, even if it was true that it was like the flu, which it is not? But I digress. Can we please talk about President Biden's new policy providing these 4 free test kits to households? I know for Vlad and I, our spouses were immediately online and they got the test kits before we could even get on the website. So at least in our bubble, people are taking advantage. Do you think that this is going to make an impact, or do you think maybe it's a little too late?
Well, I think the answer is yes to both of them. First of all, I do think it's going to make an impact. We need COVID tests, regardless of whether it's too late or not. But we need them, and we need to really be incorporating rapid COVID testing for our daily lives, before we get together with others, which, by the way, should be still restricted to some degree. But these tests really should become a part of our normal sort of going about, just to make sure that we are safe if we need to go and be around other people for other reasons. So that is super important. But is it a little too late? I mean, look, I wish we had these tests a month ago. I wish we had them 2 or 3 months ago. But I'm happy. Late is better than never, and I feel that way here. We need them, even though it's later than I would have eventually or ultimately liked.
Let's talk about Pfizer, who the company is saying that they have an oral pill that is showing efficacy against Omicron in lab tests. If it turns out that this is a viable product, how would this pill be used to fight COVID once it's available?
Oh, so Paxlovid is a pill that we actually have right now. That's been given the emergency use authorization it's an antiviral COVID pill that we have right now. The problem is that it's just in short supply. It's hard to find. I've actually tried writing this medication to patients in my office, and there is some sort of maneuvering that one has to do. Certain pharmacies carry it. There are also certain restrictions about the medication, meaning it's not right for everyone in terms of underlying medical conditions or medications that the patient is on. You have to be very careful about these things. But look, I've always said about antivirals for COVID, they are potentially a game changer. It's another tool that we have in our arsenal of sort of treatments against COVID. We don't have that many for people who are not hospitalized. That, of course, is what Paxlovid or these antiviral pills are for, is for people that are not in the hospital. So aside from monoclonal antibodies, we really didn't have much at all. This is another tool. We just need more of it. And of course, as physicians, we have to be mindful about who we're prescribing it to. But I do think that it's very, very important.
All right, Dr. Jen Caudle, as always, we thank you, doctor. Appreciate it.
Thank you.